Health correspondent Ashish Joshi has this special report from King George Hospital in East London and a warning it does contain references to self-harm.
Just let me go. Please. Please.
This is body cam footage worn by hospital security staff. It shows patients in a mental health crisis inside a busy A&E. Like physically ill patients, they require the most urgent care, but are now facing some of the longest waits on record. And overstretched hospital staff are desperately trying to keep each other and everyone else in their care as safe as possible.
He is not comfortable, he'll definitely need mental health act assessment.
It's Wednesday morning, and the A&E team at King George's Hospital in Ilford, East London, are already caring for 5 mental health patients on top of their usual acute workload. One patient wants to leave and is becoming increasingly distressed. She's already been waiting 12 hours. A security team is here to de-escalate the situation. The woman is being held under the Lack of Capacity Act and won't be allowed to leave.
We see about 150 to 200 patients a day through this emergency department, but we're getting on average about 15 to 20 mental health presentations to the department. Some of these patients can be really difficult to manage and really complex. If a patient's in crisis and wants to harm themselves, there's lots of things in this area that you can harm yourself with, so it's trying to balance that risk and make sure every emergency department in the country is deemed a place of safety, but there is a lot of risk that comes with emergency departments because they're not purpose-built for mental health patients.
Ajay Kumar and his wife are waiting patiently by their son's bedside. He suffered from psychotic episodes since starting university in 2018. And he can become unpredictable and violent.
So when you came 2 days ago, how quickly was he seen and did he get the help he needed?
Let's say we came 3 o'clock, he came 3:30. Then he stayed away, say, section.
He was sectioned?
In section 3, which is 6 months in the hospital.
But he's here now?
He's still here now because they haven't got the bed. They sectioned him, he should be insecure now, yes? He shouldn't go out in the public. Last night, he ran away at night.
From hospital?
Yes, and he walked all the way home. Took him 4.5 hours to come home. I'm in Ilford, 3.5 miles away. Even though he's totally mental, he still find his way home. And he was so tired. And the police was looking for him.
So now you and your wife will have to sit by his bedside until he's found a mental health bed. Yeah. And that could take days.
Could be days, I don't know how many. They're not telling us anything.
New Freedom of Information data shows that over the last 5 years, more than 1.3 million people in a mental health crisis presented to A&E departments. And that's expected to be a significant underestimate, with only around a quarter of English trusts providing data. And for these patients, waits of 12 hours or more for a mental health bed have increased by more than 380%. Over the last decade, the number of overnight beds in mental health units declined by almost 3,700. That's around 17%.
We've seen, particularly over the last few years, a real increase in the number of people in mental health crisis coming into A&E for support. I don't know if this is because of the pandemic or wider economic pressures, but what we're seeing every day is more and more people coming here as their first port of call. If you get someone who's really distressed, someone who's perhaps experiencing psychosis, etc., I'm seeing increasing numbers of complaints from other patients and their families about the environment they've had to wait in. And they're not blaming the mental health patients for being here, but what they're saying is being in a really busy accident emergency with ambulances, with somebody who's highly distressed, and you're sat there with an elderly relative or a sick child or whatever. It's hard for everyone. There's no blame in this. It's something we've got to work together to try to fix.
The King George, like other hospitals around the country, is having to construct makeshift mental health spaces to try and tackle the problem.
So this is one of 2 rooms that when we were undergoing our works, we recognised, it was about 3 years ago, we recognised mental health was causing us more of an issue. So we've had 2 rooms kind of purpose-built. They're as compliant as we can get them with a mental health room, and they're ligature light as opposed to ligature free. They're under 24-hour CCTV surveillance.
They're reinforced doors, aren't they?
Reinforced doors, and so that they do lock. There are obviously 2 doors, so there is a method of escape for staff if needed to be.
It's quite unusual to have a dedicated mental health suite within an emergency setting in an acute hospital, but that just tells you about the demand on services.
And we've got, as I said, we've got 2. If I had my time back again, I'd probably have 4 or 5 or 6, because these have helped us so much in the department with the really, really difficult patients, yes.
Joe is ex-military. He now works as part of the security team, helping to keep staff and patients safe. De-escalating mental health patients in crisis can involve restraining, isolating, or even sedating them. His team monitor the A&E CCTV from this control centre.
I've lost count the amount of time that I've been assaulted. You need to understand, sometimes the waiting, and I mean the waiting, drags on and on and on for days. We have patients here for over a week and section, and they cannot find a bed to put the patient to go to, and that patient become aggressive, and we have to try to slow them down, try to keep them as calm as possible.
Patients in a mental health crisis and attending hospital are stuck between 2 failing systems. A shortage of specialist beds means they're left untreated in a hospital not designed to help them. And they're failed by a social care network overwhelmed by demand and unable to provide the early intervention care needed. The Department of Health and Social Care told Sky News, "We recognise that people with mental health needs aren't always getting the care they deserve, and incidents like this are unacceptable. That's why we're investing £26 million in crisis support, recruiting more staff, expanding access to talking therapies, and working to reduce waiting times through our plan for change." And NHS England told us most A&Es now have 24/7 psychiatric liaison teams, so patients can get mental health support alongside physical care. The NHS is also working with local authorities to help mental health patients leave hospital as soon as they're ready, freeing up space. Ajay Kumar's son is one of those falling through the cracks.
When he's having a psychotic episode, you find it difficult to access help.
The only thing we can access is the emergency. Emergency is only there for the people who have other issues, not the mental health. There's nothing for mental health here.
That must be really hard for you to see.
Yeah, for me as mentally as well, no, it doesn't help me as well, and my wife as well.
Ashish Joshi, Sky News at the King George's Hospital in Ilford.
And if you've been affected by that report, you can contact the Samaritans at any time on 116 123 or email joe@samaritans.org.